Welcome. Today we're diving into one of the most frequently tested concepts on the BCBA exam, extinction. You'll learn to distinguish operant extinction, where a previously reinforced behavior stops producing that reinforcer, from respondent extinction, which involves breaking the learned association between a conditioned stimulus and an unconditioned stimulus. We'll compare extinction to reinforcement and punishment, break down the 4 key dimensions of extinction procedures, and walk through a clear comparison table. You'll also see how to implement operant extinction effectively and understand when differential reinforcement is a better choice. Mastery of these distinctions is critical because extinction is a core behavior change procedure, domain G, and appears across multiple exam questions. By the end, you'll be able to identify, apply, and troubleshoot extinction in real-world scenarios, exactly what the exam expects. On this slide, we're drawing a critical distinction between operant and respondent extinction, both of which are essential for the BCBA exam. Operant extinction involves withholding all reinforcement for a previously reinforced behavior, which leads to a gradual decrease in that behavior. In contrast, respondent extinction requires presenting the conditioned stimulus without the unconditioned stimulus, weakening the conditioned response until it stops. 2 key phenomena to remember are the extinction burst, an immediate spike in behavior when operant extinction begins, and spontaneous recovery, where the behavior reappears after a pause, occurring in both types. For the exam, focus on this core difference. Operant extinction targets the consequence-behavior relationship, while respondent extinction breaks the stimulus-stimulus pairing. Understanding these mechanisms helps you select the correct procedure in scenarios. For instance, if a client's tantrum is maintained by attention, you'd use operant extinction. If a conditioned fear response is involved, respondent extinction applies. This slide provides a critical comparison for the BCBA exam, distinguishing operant extinction from reinforcement and punishment by their mechanisms and effects. Operant extinction involves withholding the reinforcer that previously maintained a behavior, leading to a predictable extinction burst, an initial increase in frequency or intensity, and possible spontaneous recovery, where the behavior reappears after time without reinforcement. It can also trigger emotional responses or aggression, which is why the exam emphasizes combining extinction with differential reinforcement to strengthen alternative behaviors. In contrast, positive reinforcement increases behavior by presenting a desirable stimulus contingently, like praise or tokens, and is essential for building replacement behaviors. Positive punishment, however, decreases behavior by adding an aversive stimulus, such as reprimands, but carries ethical concerns and potential side effects. For the exam, you must differentiate these processes. Extinction removes the maintaining reinforcer, reinforcement adds a preferred stimulus, and punishment adds an aversive one, each with distinct outcomes and ethical implications for intervention design. When implementing extinction, BCBA candidates must understand the 4 key dimensions that can arise during the procedure. First, an extinction burst often occurs, an immediate, temporary spike in the behavior's frequency or intensity when reinforcement is first withheld. This can alarm caregivers, but it signals the procedure is working. Next, spontaneous recovery may happen, where the behavior reappears after a period without reinforcement, requiring continued intervention to prevent accidental reinforcement. Extinction can also produce emotional effects like aggression, crying, or frustration, particularly in operant extinction, which is critical to anticipate for client and staff safety. Finally, response variability emerges as the organism tries new behaviors. This increased variability can be shaped into more appropriate alternatives. On the BCBA exam, you may be asked to identify these effects in scenario-based questions or distinguish between operant and respondent extinction. Recognizing these dimensions helps you design effective extinction plans and prepare stakeholders for temporary challenges. This slide presents a crucial distinction for the BCBA exam. Operant extinction involves withholding the reinforcer that previously maintained a behavior, like ignoring a child's tantrum for attention, while respondent extinction involves presenting the conditioned stimulus without the unconditioned stimulus, such as playing a tone without pairing it with a shock. In operant extinction, the behavior decreases because the reinforcer is removed. In respondent extinction, the conditioned response weakens because the CSUS pairing is broken. Both processes share features like spontaneous recovery, where the behavior or response reappears after a break from extinction. However, an extinction burst, A temporary increase in behavior is common in operant extinction, but less so in respondent extinction, where emotional responses may instead appear. On the exam, you must identify which type of extinction applies based on the maintaining contingency. So practice distinguishing between a behavior maintained by reinforcement and a reflexive response to a conditioned stimulus. To implement operant extinction effectively on the BCBA exam, you must first identify the specific reinforcer maintaining the behavior through functional assessment. Targeting the wrong variable will not reduce the behavior. Consistency is critical. Withholding that reinforcer every single time the behavior occurs prevents intermittent reinforcement, which would only strengthen the behavior instead of extinguishing it. Be prepared for an extinction burst, a temporary increase in frequency or intensity, and ensure stakeholders understand this so they don't accidentally reinforce it. Pair extinction with differential reinforcement of alternative behavior, or DRA, to teach and reinforce a more appropriate response, making the intervention more effective and ethical. Finally, monitor for side effects like aggression, emotional outbursts, or spontaneous recovery, and adjust the plan to maintain safety. On the exam, expect questions that test your ability to distinguish effective extinction from common pitfalls, such as inconsistent application or failure to plan for bursts, and remember that extinction is most powerful when combined with reinforcement-based strategies. On this slide, we compare extinction alone versus differential reinforcement, a critical distinction for the BCBA exam. With extinction, you simply withhold reinforcement for the target behavior, which decreases it but often slowly, and there's no direct effect on alternative behaviors. The risk of an extinction burst is high, and the procedure can feel aversive to the client, potentially impacting social validity. In contrast, differential reinforcement combines extinction of the target with reinforcement of an alternative behavior. This leads to faster reduction of the target behavior because the alternative is strengthened, lowering the likelihood of an extinction burst. It also teaches a new, functional skill, making it more socially acceptable and client-friendly. On the exam, you may be asked to choose the most ethical or effective intervention. Differential reinforcement is often preferred for its balanced approach. Remember, extinction alone may be necessary in some cases, but differential reinforcement offers a proactive, skill-building alternative that aligns with best practices. To implement operant extinction effectively, you must begin with a functional assessment to pinpoint the maintaining reinforcer, whether it's attention, escape, or access to tangibles, because extinction only works when you withhold that specific consequence. Next, define the procedure clearly. Specify exactly which reinforcer is withheld and under what conditions, ensuring all implementers apply it consistently. Training stakeholders is critical, as you must prepare parents and staff for extinction bursts, a temporary increase in behavior, and spontaneous recovery, so they don't inadvertently reinforce the behavior during these challenging moments. Finally, monitor and adjust by collecting data on both the target behavior and any alternative behaviors. If progress stalls or side effects like aggression emerge, you may need to modify the intervention. For the BCBA exam, remember that extinction is not simply ignoring behavior. It requires a precise, function-based plan, and you must be ready to troubleshoot common pitfalls like burst responses and lack of treatment integrity. Respondent extinction is the process of weakening a conditioned response by presenting the conditioned stimulus alone, without the unconditioned stimulus it was previously paired with. For BCBA exam candidates, it's critical to distinguish this from operant extinction. In respondent extinction, you break the stimulus-stimulus pairing, whereas operant extinction involves withholding a reinforcer following a behavior. When extinction is first implemented, BCBAs must anticipate and plan for several predictable side effects that are frequently tested on the exam. The most well-known is the extinction burst, where the target behavior temporarily increases in frequency, duration, or intensity before decreasing. A critical concept because it often leads practitioners to mistakenly abandon the procedure. Clients may also display emotional responses such as crying, aggression, or frustration, particularly if the behavior previously produced strong reinforcement. This underscores the importance of pairing extinction with reinforcement-based alternatives. Spontaneous recovery is another key side effect, where the behavior reappears after a period of no reinforcement, which can mislead practitioners into thinking extinction failed, when in fact continued implementation is required. Finally, response variability occurs as the organism tries new behaviors to obtain reinforcement. This is actually a therapeutic opportunity, as those novel responses can be shaped into more appropriate alternatives. On the exam, you may be asked to identify these side effects in a scenario or select the best course of action when they arise. When using extinction, ethical practice requires you to prioritize client safety above all else. Never apply extinction to dangerous behaviors that could cause harm, as this violates the core ethical principle of doing no harm. Instead, lead with reinforcement-based procedures. You must also obtain informed consent by clearly explaining the procedure and its potential side effects, such as the extinction burst, so stakeholders can make an informed decision. On the BCBA exam, expect questions that test your ability to identify when extinction is contraindicated and how to ethically implement it. Always combine extinction with differential reinforcement to increase appropriate replacement behaviors, which reduces the likelihood of aggression or emotional outbursts. Continuous data collection is essential to monitor the target behavior and any collateral effects, allowing you to make timely, data-based adjustments. Finally, plan for relapse. Spontaneous recovery is common, and having a maintenance plan ensures long-term success. The exam will assess your ability to apply these safeguards in real-world scenarios. On this slide, we're comparing operant and respondent extinction side by side, a distinction the BCBA exam often tests. Operant extinction involves withholding the reinforcer that maintains a voluntary behavior, like ignoring a child's whining for attention. Respondent extinction, by contrast, breaks the stimulus-stimulus pairing by presenting the conditioned stimulus without the unconditioned stimulus, such as repeatedly playing a tone without food. Notice that the maintaining variable differs. Consequences drive operant behavior, while antecedent pairings drive respondent behavior. A key exam point is the extinction burst, a temporary increase in behavior, which is common in operant extinction but less so in respondent extinction. Why? Because operant behaviors are shaped by their history of reinforcement, making the sudden loss of that reinforcer more disruptive. Respondent behaviors, being reflexive, are less prone to that initial spike. Memorizing this table helps you quickly differentiate procedures and predict client responses on scenario-based exam questions. For the BCBA exam, you must understand that extinction is both a procedure, what you do by withholding reinforcement, and a process, which is the resulting decrease in behavior over time. This distinction applies to both operant and respondent extinction, so be ready to identify each on the test. A critical takeaway is that extinction is rarely best practice on its own. You should always pair it with differential reinforcement, such as DRA or DRI, to increase appropriate behaviors and reduce side effects like extinction bursts, spontaneous recovery, and emotional responses. Remember, these side effects are normal and temporary, not signs of treatment failure. Before implementing extinction, a functional assessment is essential because extinction only works if you know and can control the maintaining reinforcer. Finally, prioritize client safety. Never use extinction for dangerous behaviors. Instead, rely on reinforcement-based procedures and plan for ethical implementation. On the exam, expect questions that test your ability to distinguish extinction as operation versus process, anticipate side effects, and apply it ethically alongside reinforcement. As we close, remember that extinction is not simply ignoring behavior. It's a precise procedure where you withhold the maintaining reinforcer for operant behavior or repeatedly present the conditioned stimulus without the unconditioned stimulus for respondent behavior. The key distinction for your exam is that operant extinction decreases voluntary behavior, while respondent extinction weakens reflexive, elicited responses. You must also anticipate the extinction burst, emotional behavior, and spontaneous recovery as natural side effects, not signs of failure. Crucially, extinction is most ethical and effective when combined with differential reinforcement. Never use it alone if you can reinforce an alternative. On the BCBA exam, be ready to identify whether a scenario describes operant or respondent extinction, recognize when extinction is being misapplied, and choose interventions that prioritize client dignity. You've mastered the distinctions, procedures, and ethical safeguards. Now trust your preparation and walk into that exam with confidence. You've got this.